Advanced diabetes is a condition that requires specialized care and treatment. When creating texts and content for people with advanced diabetes, it is important to consider the specific challenges these people face and offer practical information and guidance. One of the main concerns for people with advanced diabetes is blood glucose management. It is important to provide detailed information on how to monitor and control blood glucose, including advice on how to adjust the dosage of insulin and other medications according to changes in blood sugar levels. It is also important to provide information on how to deal with possible complications from advanced diabetes, such as vision problems, neuropathy, kidney disease and cardiovascular problems. People with advanced diabetes need to understand how these complications can affect their health and quality of life, and what they can do to minimize their risk. In addition, it is important to provide information about proper diet and nutrition for people with advanced diabetes. A balanced diet can help control blood sugar, maintain a healthy weight and prevent complications. It is important to provide guidance on foods to avoid, foods to eat in moderation, and foods that are healthier for people with advanced diabetes. Another important aspect to be considered is the importance of physical activity for people with advanced diabetes. Regular physical activity can help control blood glucose, improve cardiovascular health and reduce the risk of complications. It is important to provide information on how to incorporate physical activity into their daily routines and on the types of exercise that are most suitable for people with advanced diabetes. In addition, it is important to provide information about the latest treatments and options available for people with advanced diabetes. This may include information about new drugs, technologies and therapies, as well as information about ongoing clinical trials and other relevant studies. In summary, creating texts and content for people with advanced diabetes requires a clear understanding of the specific challenges these people face. Providing practical information and guidance on how to manage blood glucose, prevent complications, follow a healthy diet, incorporate physical activity into their daily routines, and explore available treatment options can help people with advanced diabetes manage their condition and live a healthy life. Productive. There are several treatments available for people with advanced diabetes, and the choice of the most appropriate treatment will depend on several factors, such as the severity of the condition, the age of the patient, comorbidities, among others. One of the most common treatments for advanced diabetes is the use of insulin. Insulin is a hormone produced by the pancreas that helps regulate blood sugar levels. People with advanced diabetes may need higher doses of insulin to control blood glucose, and the treating physician should carefully monitor the dosage and adjust it as needed. Another common treatment for advanced diabetes is the use of oral medications to control blood glucose. These drugs can help stimulate the pancreas to produce insulin, reduce insulin resistance, and reduce the absorption of carbohydrates in the intestine. In addition, there are more advanced treatments for advanced diabetes, such as insulin pump therapy and pancreatic cell transplantation. Insulin pump therapy is a treatment that involves administering insulin through an electronic pump, which delivers controlled doses of insulin throughout the day. Pancreatic cell transplantation is a surgical procedure that involves transferring healthy pancreatic cells into the body of a person with advanced diabetes. In addition to conventional medical treatments, there are other approaches that can help manage advanced diabetes. For example, eating a healthy, balanced diet, exercising regularly, and reducing stress can help control blood sugar levels and reduce the risk of complications. It is important to remember that the treatment of advanced diabetes is a personalized approach, and the treating physician must work with the patient to identify the most appropriate treatment for their individual needs. It is essential for people with advanced diabetes to follow their doctor's recommendations, regularly monitor their blood sugar levels, and participate in regular follow-up examinations to ensure that their condition is being properly managed. In addition to conventional treatments and non-pharmacological approaches, there are some complementary therapies that may be helpful for people with advanced diabetes. For example, acupuncture, massage and aromatherapy can help relieve stress, reduce pain and improve quality of life. However, It is important to remember that these complementary therapies should not be used as a substitute for conventional medical treatment. They are to be used in conjunction with medical treatment and only with the approval of the treating physician. Another important aspect of treating advanced diabetes is managing other health conditions. People with advanced diabetes are more likely to develop other health conditions, such as heart disease, kidney problems, and diabetic neuropathy. It is important that these conditions are properly monitored and treated to reduce the risk of complications related to advanced diabetes. Finally, it is important that people with advanced diabetes receive emotional and psychological support. Advanced diabetes can be a stressful and challenging condition to deal with, and many people may experience anxiety, depression, and other emotional issues related to their condition. It is important that these issues are properly addressed through therapy, group support, or other available resources. In summary, the treatment of advanced diabetes is a personalized approach that involves a combination of conventional medical treatments, non-pharmacological approaches, complementary therapies and management of other health conditions. It is important for people with advanced diabetes to work closely with their treating physician to develop an appropriate treatment plan and receive regular follow-ups to ensure their condition is being managed properly. In addition, there are some preventive measures that can help reduce the risk of developing advanced diabetes or slow the progression of the disease in people who have already been diagnosed. Some examples include: eat a healthy, balanced diet with an emphasis on fiber and nutrient-rich foods such as fruits, vegetables, whole grains, and lean protein. It is also important to limit your intake of sugar, saturated fats and processed foods. Maintain a healthy weight. Being overweight is a risk factor for advanced diabetes and other health conditions. Losing weight or maintaining a healthy weight can help reduce the risk of developing advanced diabetes and improve blood glucose control in people who have already been diagnosed. Practice physical activity regularly. Exercise can help control blood sugar levels, improve insulin sensitivity, and reduce the risk of complications related to advanced diabetes. It is important to talk to the doctor responsible for the treatment to determine the type and intensity of exercises suitable for each case. Quit smoking. Smoking is a risk factor for advanced diabetes and other health conditions. Quitting smoking can help reduce your risk of developing advanced diabetes and improve your overall health. Control blood pressure and cholesterol. High blood pressure and high cholesterol are risk factors for advanced diabetes and other health conditions. It is important to control these risk factors through medication and lifestyle changes, such as eating a healthy diet and exercising regularly. In summary, there are several preventive and therapeutic measures available for people with advanced diabetes. It is important for people with advanced diabetes to work closely with their treating physician and follow their recommendations to ensure their condition is being managed properly and to reduce the risk of complications related to advanced diabetes.